name is Mark Gerig. I grew up in Clovis, New Mexico. I have a wife and 11-year-old daughter. I went to my college. I went to Texas Tech University, and then I went to podiatry school after that in Arizona, and then my residency was in Albuquerque. And I actually got out of residency 10 years ago, so I've been back in Amarillo practicing for 10 years, and my family is happy to be in this area again. We have family that still lives in the area. I still have family from Clovis, Lubbock, Plainview, so in the region basically. So we're happy to live here and be back home close to our family. It's important to us. So a lot of people think of podiatry, or when they think of podiatry, they think of routine, palliative care, which is like trimming nails, calluses, things like that, which is part of podiatry for sure. And I do a lot of that, and as do all podiatrists do a lot of that. But there's other aspects of podiatry that people don't think about, and they tend to think about orthopedic surgery more than podiatry. But podiatry does do surgery. We do have the credentials for that. We have a certified surgical board that we have to submit cases, pass examinations in order to get those certifications. So, we do treat fractures. We do treat other things that have to have surgical intervention, where a lot of people think orthopedic surgery right away, where it would be good to know that podiatrists are qualified to do that. And I myself, I did a 3-year surgical residency in surgery, and I have the certification. I have the board surgical certification for that. So when you have problems like that, you can see a podiatrist for foot and ankle issues. It doesn't have to be just palliative care. I grew up in a family, I'll say, that really values helping others. And you get a lot of fulfillment. I get a lot of fulfillment myself out of helping people. So I knew I wanted to do something in medicine. I just didn't know what it was exactly. So when I was in school, I shadowed a podiatrist in Lubbock, and I kind of liked what it was about. I like doing hands-on procedures, small procedures in the office, things like that. So that's what kind of led me towards that. I have people every day I see now who say when their feet hurt, everything hurts. So if I can just make that a little bit better for them, that makes me happy, and hopefully it makes them happy too. But that's how I got into podiatry. Most commonly is, obviously there's the diabetic aspect of it. So I see a lot of diabetics with foot wounds and problems like that, but a lot of other things that I treat would be like ingrown toenails, surgical correction for bunions, fractures, so surgical correction for fractures. Plantar fasciitis is a big one, which everyone knows as heel pain. That's what most people call that, heel pain. But most of the time that heel pain is actually plantar fasciitis, so that's a common one to treat. And then other than that, maybe sports injuries, sprains, fractures, different things like that. But I would say those are the most common things that are treated. I'll give a simple answer that maybe is too simple, but I see all the time people that have foot problems literally because they're not paying attention to what types of shoes they're wearing. And I know that sounds very non-medical, very simple, but diabetics, for instance, they have neuropathy, they walk and step on things, they have no idea it's in their foot. I spend time, I've taken out insulin needles from the bottom of people's feet, other foreign bodies, and then you talk about, so they need to be wearing appropriate shoes. Then you talk about children, same thing. Children run around barefoot, which we all did when we were kids, but I've taken large pieces of wood out of the bottom of kids' feet. I've taken tips of pencils out of the bottom of kids' feet. So if they just wore shoes too, a lot of that could be avoided. So it sounds too simplistic, but pay attention to what shoe you're wearing with the activity you're doing. And that really could, honestly, you could avoid a lot of things if you just did that, if you just paid attention to that. So that's a broad thing, it's very simple, but to avoid all those things you said, that's probably the most simple treatment I would tell people to do. So I'm coming to Dalhart once a month, and it's going to be the last Thursday of every month. So it won't be an exact date, but just whatever that last Thursday is every month, I'll be up here.